Good evening, everyone. Welcome to the Renaissance Center RC Chat, where we discuss mental health and other related topics. And this evening, we are discussing mental health and chronic disease. We know a lot of persons are dealing with different illnesses, whether it's heart disease, diabetes, or lupus, MS. It's a whole lot of different things that people are struggling with, neuropathy that may be caused by many diseases. So some of these things that people are dealing with also, there's also a mental health component to it, and even just thought about pain management, how some of that can be relieved through getting mental health treatment. So some of these things that we're going to talk about today affect, many of us, and we just wanted to bring this information to the community so that you can make different decisions, or just to broaden your perspective on people that you support that may have a chronic illness, and may get a better understanding of that and mental health. So thanks for joining us. Let other people know that we're on live discussing this. And as we have our guests tonight, again, I'm Dr. Carla Debnam from the Renaissance Center. And our guests tonight are Miss Angela Smith, who's a licensed professional counselor. She will be giving us her views on this topic. And Dr. Diana Baptiste, who is a nurse, professor, and wears other hats in the medical field. So she is very informed about chronic disease. So let's get started. If you have any questions, put them in the chat, and our persons that are monitoring that will let us know so that we can answer those questions. And if you need any further information about the Renaissance Center, you can check us out at www.therenaissancecenter.org, or you can call us at 410-409-0025. All right, ladies, let's get started. Miss Angela, I'm going to let you start with a brief introduction of yourself, followed by Dr. Diana.
Thank you, Dr. Carla. Thank you, first of all, for the invitation to join in this very timely topic. As you indicated earlier, I am a licensed clinical professional counselor, and I have been practicing at the New Psalmist Baptist Church. I served there as our minister of pastoral counseling, and in that capacity, providing direct services to our congregation, as well as organizing and developing ministry to help to create opportunities for people to grow and become whole. Thank you.
Thank you.
Thank you for having me, Dr. Carla. It's a pleasure to be here this evening. Just a brief introduction for myself. My name is Diana Baptiste, and I'm an assistant professor at the Johns Hopkins University. I'm also a nurse. I specialize in cardiovascular care, and I'm also a researcher. And in my research, I focus my research on studying African to find out more about how we can improve the health of African Americans overall. Thank you for having me.
That's great. So thank you, ladies, both. And so I want to start off with what's the definition of chronic disease?
Thank you, Dr. Carla. I'm happy to answer that. So chronic diseases or chronic conditions, as I'd like to call them, are typically irreversible health conditions that can last over 1 year or more, and sometimes will sustain until the end of life. Some common examples of chronic diseases you had mentioned, Dr. Carla, were diabetes, hypertension, coronary heart disease, lupus, multiple sclerosis. There's a long list, but most chronic illnesses don't have a cure, and they require ongoing medication or medical attention, which for some people can actually negatively impact their mental health. Research has shown that many people who suffer from chronic illness will also suffer from chronic stress. And I think that's going to be probably the focus of what we're going to be discussing today. But for the most part, chronic disease is really just having an illness for a long time. Most likely it's going to linger until, for a very long time or until the end of life, and requires some medical attention and medication and ongoing support.
Yeah, that sums it up. Ongoing support is it. Do you have anything to add to that, Angela?
I don't. That was very complete.
Yeah. It's because people need to know. Sometimes we have conditions, medical conditions, and don't realize because we've had them our whole life, we think that's normal, and we've normalized it. But yet it is a chronic illness that, again, we have to get treatment for. And part of the challenge with having a chronic illness is that sometimes it can manifest differently over the years. And so that's why you have to stay in touch with your primary care and all of your physicians that are involved in your care. And because of that, sometimes people get exhausted, from one medical appointment to another, sometimes having a full week of one doctor appointment after another. And I think that can lend itself to some, again, exhaustion, some mental distress and stress. And so, Angela, what are your thoughts about giving people tips that have to go to all of these medical appointments, whether it's dialysis, some other things that kind of fill your week up?
Well, first and foremost, I would encourage persons to stick to it, because I know that sometimes that can be overwhelming when you're being, required to have one doctor's visit after another. But I would ask persons to, keep the commitment to make their health a priority and to actually make the appointments. Sometimes it can be exhausting just trying to keep up with things. So what I would encourage is that persons would write things down, put them on calendars, post it around, and even have a family member or a friend who can, be their accountability person, for lack of a better word, to encourage them and to remind them to keep their commitments and to keep their appointments. I don't know how many times I've heard where someone, chose to, for whatever reason, and not to keep an appointment, only to find out that things had kind of gotten out of whack when it possibly could have been avoided, or at least there could have been some earlier intervention that may have brought about, a different outcome or less symptoms or something of that nature.
Yes. Dr.
Yeah.
Diana?
Yes, thank you for saying that, Angela. You made an amazing point about missed appointments, because there's a clear association that when people miss their regular appointments, they're more likely to become hospitalized, which is more of a burden for that person, for themselves, their family members. And hospitalization isn't always a good thing, especially for chronic illness. Most doctors want to keep you out of the hospital because the hospital, especially nowadays, is quite infectious, right? So they find that the longer you're in the hospital, the more you're at risk for infection, the more you're at risk for falls. So we really want our patients to be home and to manage their chronic diseases at home as much as possible. So we really need to be aware that those missed appointments can cause those really poor consequences that we want to avoid. So thank you for saying that, Angela. I immediately thought about hospitalizations, and that especially for those, if we want to talk about persons who have heart failure or people who are on dialysis on a regular basis, one missed dialysis appointment can lead to a 5 or 6 day hospitalization, which can, one, be burdensome, and two, can be quite expensive for some people, and that causes even more stress.
Absolutely. Lady, Dr. Carla, I would like to just point out in our discussion tonight that we not just frame our thinking and our conversation around adults. Oftentimes when we think about chronic illnesses, our first go-to is to think about adults and seniors. But the reality is that there are children, teens, young adults, all are impacted by chronic disease. So I would want for us to keep that in mind, and for our audience to keep that in mind as they are thinking about the chronic disease.
That's a good point, because we can, of course, be born with certain conditions that require, management over time and, even over a lifetime. So that's a good point. And as caregivers need to be aware that because people are battling chronic illness, whether from childhood on up or being diagnosed as an adult with certain medical conditions, that it can become, again, taxing on a person's, mental health. And I know some people that have certain conditions, whether it's heart disease, diabetes, and, people that may be recovering from strokes, sometimes along with those diagnoses, they sometimes have anxiety or depression, and it could be short term, or people that have had workplace accidents that now, I'm gonna put that in a chronic condition, because sometimes that puts people into a chronic condition scenario where now they can't return to work. And so depression sets in, anxiety sets in. How am I gonna make it? Have you all noticed any, I'm not going to say, Dr. Diana could go with this. It's not necessarily a causation, but it's a correlation sometimes with one doesn't cause the other, but sometimes we have co-occurring disorders. So.
Yeah, absolutely. So I'm glad you brought that up, because I was, so the way it works, it's really like kind of interchangeable. So if someone already has depression and anxiety, that depression and anxiety will put them at higher risk to have a chronic illness. And then if they have a chronic illness already, it puts them at higher risk for depression and anxiety. So they all are correlated. The associations are there between, and whether they develop this chronic illness as a child or later in their adult lives, they're always going to be at risk for depression and anxiety due to the overwhelming burden of the chronic disease. For example, some people just find taking medicines every day exhausting. That could be, that could feel depressing for some. So it's really weird because the way depression anxiety works is that typically if somebody's already depressed, their cortisol levels go up because they have chronic stress, and the cortisol levels will cause higher cortisol levels will put them at risk for, let's say, diabetes and high blood pressure or heart disease. But if they have diabetes already, they're going to have higher cortisol levels and then be at risk for depression. So again, it goes back and forth, and it, each feeds each other. So I think that's why the awareness of this is so important, because we don't have to live with that. We don't have to accept that, okay, because I have this chronic illness, I'm expected to be depressed. That's not true. You don't have to be depressed. There are ways that you can, work with that and just really manage your chronic illness and live a healthy lifestyle. But yeah, so they are interchangeable, whether someone has a chronic illness or, like you said, if they had an accident, if they fell at work and they no longer function the way they used to, that is their new chronic illness, and that does put them at risk for depression. So I think the best thing we can do is promote this awareness so that people can get the help that they need to battle this, to avoid the depression or anxiety or whatever mental health issue from manifesting. If they could just capture it head on and get that help, then we could really make a difference.
I would add to that there, one does kind of feed into the other, or one can cause the other, and then put that in the mix of other factors that can also contribute to one or the other. We know that health disparities has a great impact on both our mental health and our physical health. And so that one area can, take some people down the path of physical and chronic illness and or mental illness, can have an impact on their mental health. And then they both can feed one another.
Yeah, that's a good point, that we can, it's so many factors that we may be dealing with outside of our chronic illness. So relationship problems, it could be financial problems, and like you said, the racial disparities in healthcare and in the community could be a challenge. And we could be like living in a global pandemic, and that is a big stressor that people, we know people want to move on from it, but it is still in existence. It's still a challenge for us all. And it still can affect your mental health as well, because you may have been managing your chronic disease pretty well, but then a pandemic hit. And remember, at the beginning, a lot of people did not keep their regular appointments. And of course, some of the places were closed as well, in the beginning. But as people felt comfortable going back into regular treatment, like you said, by the time they went back, it's a situation now, whereas they were keeping on top of the mammograms and other screenings, that was good. But so the pandemic threw some people off of their routine schedules of self-care and good medical care. And this is something I read in an article, that when we get diagnosed with a chronic illness, right, the doctors will tell us, hey, you need to go to the neurologist, you need the orthopedic doctor, you need all of these different checkups. They never say you need to contact a mental health professional. And I thought that was interesting. And yet we know, and we just discussed, this is a big challenge, but maybe this is something in the medical field that, the doctors can also say, look, along with seeing your orthopedic surgeon, the neurologist, the physical therapist, I know you got a full schedule of appointments, but you might want to, get a mental health checkup just to make sure you're on top of that, because you don't want to add another appointment to your schedule if you can avoid it. And there are, ways we can manage it. And we'll get to that a little later. How can people accept now that they may not, I'm going to say, just get cured from their illness? So a lot of people hope that they can throw their hypertension medicine away and we can stop pricking our fingers for the blood tests if we're diabetic, or stop going in for transfusions if we have sickle cell or whatever it is. Mm-hmm. But that may not be the case. So how can those people, what kind of hope can we leave them with when their illness is it's long term? It's not going to be eradicated, we'll say.
Sorry, go ahead.
No, go ahead.
I was just going to say, first, it's always good to get a second opinion, because I think people, when you're diagnosed with a chronic illness, you're always going to deal with an initial shock. And the first thing we think is, why me? Or is this really happening to me? Right. And so denial is a natural part of a human response, especially to something that we don't want to hear. So I think it's okay to get a second opinion, just to hear it again and to help you understand what it is that has changed within your body. The other thing I would say is educate yourself. I always encourage my patients and community members to go on to, and I know most of us have access to the web, but read about that disease, but go to a good website, right? So if you are diagnosed with a heart condition, you want to go to the American Heart Association, and they have lots of easy reading stuff to help you understand what is hypertension, what is heart failure, what happens when you have a stroke. So it's, I think when you educate yourself and you inform yourself of the disease, then you get a better understanding and you get a feel for like, okay, this is why, I wake up with a headache in the morning, or, this is why I'm cranky, when I don't eat, my blood sugar's low. So it's really important. So I'd say get a second opinion, educate yourself about the condition, and think about the treatments. And so you asked about limited treatment. Yes, there are some conditions have limited treatment where the treatments are just, pretty much, if someone has a chronic illness for a long time, they might have exhausted treatment options. I want to say that cancer is a chronic illness. Cancer isn't always terminal, but it is a chronic illness, because once you have cancer, you have to keep up with your appointments and make sure that it doesn't come back. So, for example, for someone who has breast cancer, they can be cured of that for the time being. The chemotherapy will eradicate the tumor. However, they need to keep up with that healthcare. They need to read about it. They need to get their mammograms, get their scans every year to make sure that they that remission that they've achieved hopefully the cancer does not come back. But there are times where treatment is not an option. So for someone who may have a terminal illness, we really have to think about not so much giving up on treatment, but redirecting that treatment, right? So we have to accept at that point that, okay, there is no cure, but what can I do to improve my quality of life? How can I make myself comfortable as a patient through this chronic illness? And so palliative care, a lot of people, think the palliative care is synonymous with hospice, and it isn't. Palliative care is not end-of-life care. Palliative care is based on a science of treating symptoms and providing comfort. Mm-hmm. And so, I really urge people that if you really think that your symptoms are overwhelming and there is no real curative treatment, sickle cell would be an example of that, right? There's no cure, but there are some things that a palliative care specialist can do to help you be comfortable in that space of sickle cell anemia, or in that space of stage 4 cancer, or in that space of multiple sclerosis. Because again, I think sometimes we go into the doctor's office, we're always hopeful, and I think we should never lose hope, but we're always hopeful for a cure. However, the reality is that a cure is not always an option. But, with where science has come, we've come a long way with science where treatment has really helped us live longer. There are ways that we can improve our quality of life. And so really just exploring those options, I think, is really helpful in those situations.
Yeah, that's really good.
So, what I would say also is sometimes we cannot stir people away from, their feelings of, this is not going to get better. And so what I would encourage is for those persons who are around them to support them as best they can. As Diana said, denial is a defense mechanism. It helps. It's our way of dealing with something that we can't quite wrap our brains around. So early on in the game, for a lot of people, there is denial, and for some, that path kind of is a slow path. So I would just encourage persons, to who are supporting chronic people who have chronic illnesses, that they are gentle, that they extend grace to allow the person to be where they are, to let them take baby steps, and all of the things that Diana said, about encouraging the person to arm themselves with information.
Yeah.
I would also encourage persons to hold their caregivers accountable. And what do I mean by that? I mean, not just going into the office and accepting everything at face value, but asking questions, asking for explanations, asking for what else is there? Is there anything else? But very much using their voice and using their power to take control of as many facets of their illness as possible. What persons are dealing with often in their early diagnosis and finding out that things are not going to get better is their loss of control. They no longer have control over some facet of their life. Gaining knowledge helps to give them back some of that control.
Yeah, that's great, because you can have a conversation. The more you arm yourself, you can ask the doctor questions. And, so often when they say, do you have any questions? We say no. And part of it is, I got a question. What if you avoid the doctor? This is from the audience, because you don't want to know what's going on. You're scared. You have a new condition. You already know about the one that's chronic. Now you're scared to follow up. What advice do we have for those people?
I would say, and I know Diana will go in much more detail. I would say that the possibilities of things becoming worse by your not going would be an incentive to go, because if eventually your body will demand attention. It will demand attention. It sends out a signal: you either see me now or you will see me later, but you will see me. And so understanding that there is fear, we sometimes have to talk some of our fear down to really get to the place where we have some things that we can control. We have some opportunity to make some choices. But if we don't go, then we have no opportunity to make choices, to make informed choices.
Absolutely, Angela. You said everything that I was thinking. So, and I'll just say it plainly, if you don't go, sometimes, like Angela said, your body will make that decision for you. And, instead of driving to the doctors, you might get there via ambulance, which is much more traumatic and dramatic. An ambulance ride, if anyone has ever been in an ambulance, is a very traumatic experience for most people. And that's not the way you want to be taken in to find out that you have a new condition. So I would just echo what Angela says, knowledge is power. Educate yourself, read about it, and give yourself that power and say, I really don't want this chronic illness. I know that it's going to change my life, but I have to take charge of this because I want to live longer and I want to live better. Think of those people that you love. If they had a chronic illness, you would want them to go to the doctor immediately. So you want to make that same decision for yourself. Avoidance is, is easy, but the consequences are much more severe. I say avoid for one day, take a deep breath, take a hot bath, have a glass of wine, coffee, whatever that relaxes you. 24 hours, decompress, call a friend, call your pastor, call the person you love the most, call them, talk to them, speak it out loud, and then go to the doctor. But please don't wait too long. And again, sometimes depending on what you're dealing with, 24 hours might be too long. So listen to your body, know what you're feeling. If something is different, if something is hurting that you never felt before, you might want to just get that checked out immediately. So just take good care of yourselves. I mean, I kind of get emotional by saying this because I've dealt with this so much in our community where fear really guides us and it leads us to avoiding medicine and avoiding the care that we truly deserve. And I really want to urge you to find your strength in that way and get yourself the medical attention that you truly need.
Yeah, that's great advice because a lot of people are suffering in silence. Their family members don't even know that they haven't followed up on recommended treatments. And so sometimes as family members and caregivers, we're concerned about people, but we know we can only support them in the decisions that they're making sometimes. But often if you get the right person in the family, like a grandchild or someone that can tug on the hearts of the person you care about that isn't, following up with treatment, that may work. Or just, having that support system around you. And so part of it is the caregivers, the friends, the families, and just overcoming that fear, which is a big part of having certain illnesses. The fear of, is this hospitalization going to turn into something more challenging than I anticipated? And having, gone with people that had different illnesses to the hospital, it's traumatic for me as a caregiver and as a friend. So we want you all to stay on top of your treatments because it's a lot for your loved ones as well. And so going to loved ones, we know that being, supportive of our family members and friends on their journey is important. But what tips do you have? Sometimes as friends and family, we can be overbearing sometimes without support. The scared straight, if you don't go, I'm not going to call you anymore. Different things we might do. So what's a healthier options and tips you have for caregivers and friends?
I would say if someone, shares that, they have some concerns and they have some fears about their illness or diagnosis or potential diagnosis, I think the first and foremost is to be present to the person. to be, and when I say present, I don't just mean to be in their physical space or on the other end of the telephone line, but to be with them, and to, in as many ways as possible, communicate that. And one of the ways to do that is simply by listening, not to be or try to be a fixer, because you can't fix. You can't fix, but to extend compassion and empathy, holding a space for a person, to fully let them know that you're with them in whatever part of the journey that they're in. Making and in doing that, you can create some space for that person to open up, to at least be willing to begin to share, and then to openly invite them to share, by simply saying something to the effect, I cannot imagine what this is for you. I am not you, but I know if it were me, this would be difficult. And say to them, what are some of the fears that you have? What are some of the things that you're afraid of? Get them to externalize that. And again, not to fix it, because you can't, but to listen. One of the things that I think people often do is they minimize people's discomfort. They don't acknowledge it. They say, oh, girl, you don't have nothing to be worried about. Everything is going to be all right. Or what we tend to do sometimes in the church is say, where's your faith? Don't you trust God? Don't you believe God? You should know better than that. Those are things that we don't want to do. We want to meet people where they are. We want to listen. We want to respect their boundaries.
That's
Angela,
good.
yeah, I agree. I think as a caregiver, we have to be very careful to be supportive and not controlling. Often the caregiver becomes a hierarchical relationship where you feel like you're in charge of that person, and you are not. They're still in charge of their lives. And we have to give them that autonomy to make decisions. So even though we feel that we know what's best for them, because it's like, well, that's my mama, I know what's best for her. I've been taking care of her condition for 20 years. That could be true, but you still have to give that person the autonomy to make their own decisions and help them feel whole. Because sometimes people don't want to be defined by their disease, and they don't always want to be reminded. Okay, because they're often reminded way too often. And this is something that I teach to my students and to nurses who I work with. One thing that really drives me a little bit wild is when people say, I have a diabetic patient. No, you have a patient with diabetes. You always put the individual first. You don't say my diabetic person with diabetes. We don't want to define people by their disease. We don't want to say kidney failure patient, a patient who is experiencing kidney failure or renal failure. So that's the first thing. We want to keep these, our people who we're caring for, we want to keep them whole. We want them to understand that they're not defined by their disease. They are still mama. They're still son. They're still who they identify by. Controlling someone during a caregiver situation causes exhaustion for both parties, because the caregiver who's trying to control will feel exhausted when their work is not, when they feel that they're not getting the results that from the person they're caring for. And the individual who's dealing with the disease will be exhausted by the controlling. And it's just something that I've just observed over the years, that I think that we have to be careful. It's easy to do. It's easy, again, like I said, it's easy to say, well, I'm in charge of this person's care, so I know best. But we really want to push away from that narrative and partner with that person in their care and help them make decisions for themselves. So instead of getting mad at mom for not taking her medicine, like Angela said, ask questions. Say, Mom, tell me about why you hadn't take that medicine. What were you feeling? You know, what were you thinking when you decided not to take this medication? Instead of accusing and assuming, you know, and just, as Angela said, meet them where they are so they can feel like a whole person within this chronic condition that they are living with.
That's good, because these things we're talking about as far as meeting people where they are, listening, being supportive and non-judgmental, and not questioning their faith when they have these questions or have these disappointments, you know, in their treatment. So, you know, I'm already on 2 blood pressure medicines. Now I have a 3rd one. And what's going on, and, you know, why isn't this under control with the 2? I've been eating right. I've been exercising. So sometimes, you know, people are doing the best they can to treat the conditions that they have. And there are some consequences and side effects that we don't often discuss. And one of them that came to my attention is, what if, due to my chronic illness, I have some level of sexual dysfunction, and now this is affecting my marriage? I mean, what can people do with that? Again, I think about being compassionate, listening, and, you know, again, this might mean another doctor appointment, but, you know, that's something you could talk to the doctor about. When he says, hey, how's everything? You don't just say, oh, we're good. And you could have said, hey, I'm having this dysfunction. I'm not interested. Things are not going well for me. So any suggestions in that area?
So I would say two approaches or 2 things. One, as you just indicated, that is a conversation that should be had with your caregiver, your provider.
Mhm.
To investigate, you know, what all may be going on, and are there any interventions that could perhaps make the situation better. The other conversation should be with your partner. You know, they may or may not know, because, and why do I say that? Because sometimes when there are issues with sexual dysfunction, people will avoid rather than have the conversation that there is a problem. So much is hooked to our ability to perform sexually. A lot of times there is a lot of shame. There is a feelings of, you know, just inaptness. You know, I'm not able to do. So there often is a lot of avoidance of that conversation, but have that conversation with the partner. If it turns out that, you know, that there are things that may not be able to be addressed to make the problem better, then talk about other ways that you can have some sexual intimacy that may not be the traditional ways that you've been able to satisfy your partner.
Yeah, absolutely, Angela. I would say the same thing. I think, you know, there needs to be a deep talk with the partner and the healthcare provider. And, you know, some sexual dysfunction is permanent, some isn't. And so, but we don't know that. So it's really important to ask questions to find out where you stand and why you're experiencing this type of dysfunction. For some people, it could be medication related. It could be something as simple as changing a blood pressure medicine, swapping one out for another, where you can regain some function. or, depending on whatever ailment it is, switching the medication or taking an additional medicine that could actually enhance sexual activity or ability. So, these are the things that these discussions, we should not feel embarrassed. We need to release the stigma off of discussions about mental health, sexual health. These are important conversations that we need to be having, and not to feel embarrassed by that, and just build trusting relationships with your healthcare provider, with your partner, or even if a friend that you trust, someone that can help you kind of just work through that. But we need to get the stigma out of that, because this happens for a lot. And so it's really great that if we can open up just a forum to discuss it more freely. So,
Yeah.
thank you. So I'm glad that question came up.
Yeah, I'm glad that question came up too, because again, these are things that can lend itself to low self-esteem. You could think, hey, I'm not the same person I was. What's wrong with me? I'm not attractive to my partner anymore. Maybe that's why these things aren't working, when it really may be something that is treatable, and yet you haven't looked it up. Or sometimes, again, it's back to educating yourself and your partner about what the side effects of certain medicines are, and or your illness, so that they can be open-minded about exploring different other options, that are best for both of you. But sometimes, again, it's the conversations that we don't have that keep us in the dark, and really keep us from being healthier. So we're talking about mental health and chronic illness, because it does impact it, but you can be joyful, and you treat if you have a mental health, if you have anxiety, depression, those are treatable. If you have a physical condition, a lot of those are treatable, and now they have even better treatment options over the years. And so things that used to be in one category of treatment 10 years ago, now these things are like, oh, okay, we got that. It's something, it's treatable, it's fixable, we can work on it. And it's important to check your mental health, because your mental health affects your physical health and your recovery rate, your ability to kind of accept and live with the prognosis and diagnosis. So you want to get in a good headspace. And one of these options I've seen in the community is support groups. So can either of you speak on the value of getting involved in support groups?
I cannot say enough, and I'm sure Diana would say the same. So there are support groups of all kinds. There are support groups for persons who have chronic illnesses. There are support groups for persons who are dealing with emotional and mental challenges. What happens in support groups, the power of support groups lies in the fact that people come to the table, and I hear it time after time after time. I found out that it's not just me. I found out that I'm not the only one. I found out that what I was thinking was not whacked, and I'm not, I'm not the only one. Just the normalization of people's circumstances. The Bible tells us there is nothing new under the sun. It's new to you, but it's not new to other people. Things that are happening to you, things that you are thinking, things that you are feeling, those same thoughts are occurring with other people. And as conversations happen in support groups, people give testimony to how they have overcome certain aspects of their situation. And they give encouragement. And I think that is one of the more empowering pieces that comes out of a support group.
Angela, I agree. Chronic illness, anxiety, and depression can be very isolating. Depression itself is isolating. That's just how depression works, right? It makes you want to ball up under the covers and crawl into a hole, and hide. But we must really think about that. We're not alone in this battle. Apart from our faith, we do have people in our lives who can relate. And I think it's just natural human behavior that when we find out that someone can relate to our experience, understands or has experienced the same, we feel better. We already feel that person doesn't even have to really say anything. We just feel encouraged in knowing that we're not alone in a battle. And so I am a huge advocate of support groups, just like Angela. For people who use social media, I think social media has changed the way we support each other in our lives. There are different social media groups out there for different chronic illnesses. If that's a comfortable space, I would say find a social media group. Online. An example is, even if you're not communicating with people, just like Angela said, hearing their testimony can provide some comfort. An example is, I actually had a friend who was diagnosed with stage 2 breast cancer in her early 40s, which was extremely scary. And she's not the social media type. She's not very social as far as going to support groups, but she watched YouTube videos of another young person who was going through the same journey. And each week that person posted a video of when they went to chemotherapy, when they went to their doctor's appointments, before and after surgery. And she was just so encouraged by that, just watching these videos and following this person for over a year and reading that person's blog and just saying, wow, I'm not alone. She's young like me, and we're going through the same thing. And so, I just think that, whatever resource you can find within your community, from your church home, online forums, maybe even YouTube, whatever makes you comfortable, seek that out and get that support. Do not crawl into a corner and think that you have to deal with this by yourself, because you don't have to.
Yeah, I would agree. This social support is critical for any, whether it's a mental illness or a physical illness. Support systems are very key. And also, you can find out sometimes different treatment options. People will say, well, this worked for me. And when you have your appointment, you can say, hey, this worked for my friend or my support group member. Is this something that will work for me and my particular, diagnosis that I have, or where I am, along the spectrum of this illness? Is this something that's for me? So a lot of times you learn information, you get to hear testimonies, and sometimes you may not feel like you want to share, but you learn a lot. And I love that people are more open to these opportunities to learn and be encouraged. Another question we have is—
Can I just, before you go to the next question, can I go back again to keeping in mind our youth, our children?
Yes.
That they particularly can benefit from support groups. The fact of the matter is, they get sick and tired of grown people telling them what to do. They get sick and tired of hearing things from an adult's perspective. When young people are together, children are together, they can share at their level of understanding with each other. They can share their experiences. Just again, being with others who are dealing with some of the same things that they're dealing with, and can be freed up to discuss it without any stigma or shame attached to it.
Yeah, when you mentioned that, I thought about like some of the young people that may need medication for ADD or ADHD, and knowing that sometimes they can get the medicine at the nurse's office or before they leave, and then saying, hey, this is something you might need, when you're explaining it to them. And they're like, oh, half my class are on it. We talk about these things. We keep each other in line. So the children have like sometimes formed their own support group amongst their peers when they have similar situations. And, they don't feel as awkward about, hey, I have to go to the tutor, or I have to go to speech class, or whatever may be their issue. And even with chronic illness, as they become more aware of the different ways to get support, it's good that, and we have Mount Washington Pediatric, they have good support groups, and for children, and it's other facilities that promote that. So parents and caregivers, make sure your children get the support they need, especially if they have some genetic or chronic illness. They need to be encouraged and nurtured just like you do. And this is a good tie-in. I'm glad you brought the children up, Angela, because what if, as a parent, your children are aware that you have a chronic illness and they're concerned about your life, your health? Am I gonna lose mommy? Am I gonna lose daddy? Children are very sensitive and aware. They'll sometimes come, pat you on the head and see if you needed something to drink. They are very supportive, but yet as children, they may not understand your illness. What advice can you give a parent, and how can they reassure their children?
I am a proponent of, again, meeting people where they are, and that goes with children as well. As you said, children are very perceptive. They are keen studiers of human behavior. And if we don't engage them in some conversation at their level of understanding, they will make up their own story. Much of the time, their story may end up being much worse than the situation really is. That can become a snowball, where the stories that they are making up are creating anxieties in them. And before you know it, they too are being impacted with anxiety and possible depression. So I would encourage parents to perhaps even start with, having a conversation with their care provider and asking them, can you give me some pointers or some directions on how I can share this information with my child at their level of understanding. But I would say, have that conversation, not to necessarily give them more than they can handle, not to give them a lot of technical language and lingo, but again, just saying, mommy or daddy is dealing with a medical issue, and we're letting the doctors help us, and we will be, or he or she will be, going to the doctor. So we just want you to know that. What do you think about that? Do you have any questions? And that's the important part. to not just drop the information, but then help them process the information and open the door to explore any questions that they have, which may not come at that moment. So give them the time to let it sink in and perhaps even check back in later.
That's great. Yeah. So, Dr. Diana, you have any?
Well, I can say I haven't worked with children and families much in my practice, but I just think that it's important to gauge, just to be honest and forthcoming with children. But again, you know, when I think about the lifespan, you also have to speak to them in an age appropriate fashion, right? We have to think about how old they are, what do they truly understand? And, you know, we don't want to minimize what's happening, but we don't want to overwhelm them with information either. So what I would do in that case is definitely, get a social worker or case manager or life coach. I know that some hospitals and doctors' offices have referrals to these types of resources that help families cope with very new or very heavy diagnoses. So I think getting that extended help is really important, because I think as parents, we don't have parents don't have a manual of like how to raise children. We kind of learn, as we go as parents. And so I think this is another learning opportunity for that person who has newly diagnosed with a chronic illness, just to use their resources and find out, just to help get that professional help to find the best way to engage their child without overwhelming them. Because that's more of my biggest concern with children, is overwhelming them. But honesty is important too.
Yes.
And particularly if there are going to be things that are going to change how the household operates. All too often, children are just observers. They are not invited into helping, with some solutions, or giving some input, or giving some thought as to how certain decisions will impact their lives. So in some instances, it would be great if there could be a family meeting and say, because of the health situation with dad, we're going to have to make some changes in our household and how we do things. Invite the children into the process of, again, age appropriate, of being able to help out, inviting them to help out. So many times we leave children out. And so they begin to feel powerless. They begin to feel left out. And if you're not careful, they become resentful.
That's good. That's good. This is some great conversation we're having. And hopefully, those who have tuned in have been able to gain information on how they can manage their own chronic illness, how they can support others, and how they can talk more and advocate for themselves, so that they will be able to treat whatever is going on, whether it's a mental illness or a chronic illness, that you get the best treatment you need. And you also make sure you keep every family member and friend in the loop and make it age appropriate, because our children are watching and they want to help out. They can sweep or do certain things. So whatever they can do. And this part that Angela ended with, that it changes the dynamic of the household, that's like a whole nother conversation. So look, we might have to pick that back up, because that is really critical. So keep that in mind as parents and caregivers, that your condition can change the dynamics of the household. And so it's, in the ball is in your court to do the best you can with the information you have. I'd like to thank Dr. Diana for joining us and Miss Angela. They've been great, very informative. And I know we had technical difficulties early on, but hopefully you got the meat of the program. Again, this is Dr. Carla Debnam from the Renaissance Center. You can call us at 410-409-0025 or check us out on the web at www.therenaissancecenter.org. Thank you. We'll see you next month